Hello everyone, Dr. ALAN MANDELL here. Welcome back to my channel, Science of Healing. You feel it coming, that clear, undeniable urge. You walk to the bathroom, sit down, and nothing. Or worse, a small, hard piece passes, and you're left with that maddening feeling that something is still in there, still stuck right at the exit. If that sounds familiar, you are not imagining it. The stool really is stuck, not high up in your colon, but low in the rectum itself. And that is a completely different problem from regular constipation, which is exactly why most laxatives fail you. In the next few minutes, I'm going to show you why this happens, the 1 teaspoon remedy that can move things in as little as 30 minutes, and how to stop it from coming back. Here's the key point most people never hear. There are 2 very different kinds of constipation, and they need 2 very different solutions. The first kind happens high up. Stool moves too slowly through the colon, dries out along the way, and takes days to reach the exit. That's what most laxatives are designed for. The second kind is what you're dealing with. The stool already made it down. It reached the rectum, but once it got there, it stopped. It won't come out. This is called outlet constipation or dyschezia, and it is incredibly common, especially after age 50. So why does it get stuck right at the finish line? Think of the rectum as a holding chamber. It's the last few inches before the exit. Wrapped around the bottom of it is a muscle called the puborectalis, which acts like a sling. When you're standing or sitting upright on a modern toilet, that sling pulls the rectum into a kink, almost like a garden hose with a bend in it. That kink is what keeps you continent during the day. But when it's time to go, that muscle has to relax. If it doesn't, the stool hits the bend and stops. On top of that, when stool sits in the rectum too long, the body keeps pulling water back out of it. So the longer it waits, the harder and drier it becomes. Eventually, you get a firm plug right at the exit that simply will not move on its own. The usual causes? Low fiber, not enough water, ignoring the urge when life gets busy, certain medications, opioids, iron supplements, some blood pressure drugs, pelvic floor muscles that have forgotten how to relax, and the simple fact that all of these problems get more common as we push, the worse it gets. Straining doesn't open that kink, it tightens it, and it sets you up for hemorrhoids, fissures, and even prolapse. So let's get to what actually works. When the stool is already stuck in the rectum, you don't need something that travels through your whole digestive tract for 2 days. You need something that pulls water into the stool that's already down there right now. The remedy is 1 teaspoon of milk of magnesia. That's magnesium hydroxide, taken on an empty stomach with a full glass of water. Here's why this works when other things don't. Magnesium hydroxide is what's called an osmotic agent. In plain English, it pulls water out of the surrounding tissues and into the stool. So that hard, dry plug sitting in your rectum starts to soften from the inside. Within 30 minutes to a few hours, most people feel the urge return. And this time, things actually move. 1 teaspoon is about 5 milliliters. That's it. You do not need a tablespoon. You do not need more. More is not better here. Too much magnesium can cause loose stools, cramping, and even electrolyte problems, especially if you take it often. For occasional use, once in a while when you're truly stuck, 1 teaspoon is the sweet spot. A few important cautions. Do not use magnesium hydroxide if you have kidney disease. Your kidneys are what clear magnesium from your body, and if they aren't working well, magnesium can build up to dangerous levels. Be careful if you have certain heart conditions or are on medications that affect your electrolytes. And if you take prescription medications, check with your own physician. Magnesium can interfere with the absorption of some drugs, so timing matters. Now, if you prefer something even more local and even faster, there's a second option, a glycerin suppository. You insert it into the rectum and it works right where the problem is. It draws water into the stool and gently stimulates the rectal wall to contract. Most people feel results in 15 to 30 minutes. For a stool that is literally right at the exit, this is often the fastest, gentlest solution there is, and it's available at any pharmacy without a prescription. What I want you to avoid, especially as a regular habit, are the harsh stimulant laxatives, the ones based on senna or bisacodyl. They work by irritating the bowel into contracting. They can cause cramping, urgency, and over time, your bowel can become dependent on them to move at all. For an occasional stuck stool, osmotic magnesium or a glycerin suppository is a smarter, gentler choice. 1 teaspoon, empty stomach, full glass of water. That's the rescue. But here's something most people miss. You can take the perfect remedy and still sit on the toilet for 20 minutes with nothing happening because your body is in the wrong position. Remember that muscle I mentioned earlier, the puborectalis sling that kinks the rectum closed? When you sit upright on a modern toilet, that kink stays partly in place. You're essentially asking stool to push through a bend. No wonder it gets stuck. The fix takes 60 seconds to set up and changes everything. Get a small step stool, 6 to 9 inches high. Place it in front of your toilet and rest your feet on it. Now your knees are higher than your hips. Lean forward slightly and rest your elbows on your knees. This single change, knees above hips, body leaning forward, straightens the angle inside your rectum. The kink unfolds, the path opens. Now the second piece, which matters just as much. Relax your belly outward. Do not suck it in, do not clench. Let it soften and push gently forward. Then breathe. Slow inhale through the nose, letting the belly expand, and a long, slow exhale through the mouth. As you exhale, simply let go. You are not pushing, you are releasing. This is the opposite of what most of us learned. We were taught to hold the breath and bear down. That actually tightens the pelvic floor and clamps the exit shut. Belly breathing tells those muscles to release. Try this combination. Feet up, lean forward, belly out, slow exhale, and you will often feel stool that has been stuck for hours simply slide out on its own. No straining, no force, just mechanics done right. Now let's move from rescue to prevention, because the goal is not to keep reaching for milk of magnesia every week. The goal is to make sure stool never gets that hard in the first place. There are 3 specific foods that do this remarkably well. Each one has real research behind it. Each one is cheap and easy to find. And when you use them together, most people stop having stuck stool episodes altogether. The first is kiwi fruit. 2 green kiwis at dinner, that's the dose. Studies have shown that 2 kiwis a day improve stool frequency, soften stool consistency, and reduce straining within just a few weeks. Kiwi contains a unique combination of soluble fiber, water-binding compounds, and a natural enzyme called actinidin that gently supports digestion. Eat them with the skin on if you can tolerate it. That's where most of the fiber lives. If not, scoop out the flesh with a spoon. The second is ground flaxseed. 1 to 2 tablespoons a day, stirred into water, yogurt, oatmeal, or a smoothie. The key word here is ground. Whole flax seeds pass right through you without doing much. Ground flaxseed is different. It provides soluble fiber that absorbs water in your gut and forms a soft, gel-like mass. That mass keeps the stool hydrated all the way down to the rectum, so it never has the chance to dry out into a plug. Start with 1 tablespoon. Drink a full glass of water with it. Work up from there. The third is prunes. 5 to 6 prunes, or about half a cup of prune juice in the evening. Prunes are nature's gentlest laxative for a reason. They contain sorbitol, a natural sugar that acts as a mild osmotic agent, pulling water into the stool just like magnesium does, but in a slower, food-based way. They also contain fiber and polyphenols that support healthy bowel function. Research has actually shown prunes to be more effective than psyllium fiber supplements for mild constipation. Kiwi at dinner, ground flaxseed in the morning, a few prunes in the evening. Simple, cheap, and quietly powerful. Here's where I have to correct 2 of the most common mistakes I see, and they're the reason a lot of well-meaning people actually make their constipation worse. Mistake number 1, adding more fiber without adding more water. This one is huge. Fiber works by absorbing water and forming a soft, bulky mass that moves easily through the bowel. But if you flood your system with fiber and don't give it enough fluid, the opposite happens. That fiber turns into something closer to concrete. It becomes a denser, harder, drier mass, and it gets stuck in the rectum exactly the way we've been talking about. So, if you start eating more flaxseed, more bran, more vegetables, you must drink more water alongside it, not optional. A practical target for most adults is around 25 to 30 grams of fiber a day, paired with 6 to 8 cups of water. Adjust up if you're larger, more active, or in a hot climate. Mistake number 2, jumping in too fast. People hear fiber is good and triple their intake overnight. The result is bloating, gas, cramping, and sometimes worse constipation than they started with. Add fiber slowly. 5 extra grams a week is plenty. Your gut needs time to adjust. And one more thing, maybe the most important of all, honor the urge. When your body tells you it's time to go, go. The rectum has a reflex. When it fills, it signals the brain. If you ignore that signal again and again because you're in a meeting, because you're driving, because it's inconvenient, that reflex starts to fade. Eventually, the rectum becomes less sensitive, stool sits longer, dries out, and gets stuck. Listen to your body the first time it speaks. Now, before we move on, I want to share something with you that completely changed the way I think about fiber and digestion. Because here's the strange truth most people have never heard. There is a small group of researchers who have shown that for some people, eating less fiber, almost none at all, combined with one specific ingredient, actually empties the bowels 2 times faster than the high fiber approach we've been taught for decades. I know how that sounds. It goes against everything we just talked about, but it's backed by science, and it traces back to an 8,000-year-old ingredient, what some are now calling an underwater gut superfood that has been used by over 3 billion people around the world. Just 1 pinch of it before your next meal is enough to soften the toxic buildup clogging the intestines and restart healthy digestion within days. No restrictive diets, no expensive probiotics, no medications. If you've struggled with stuck stool, bloating, or that heavy, sluggish feeling for months or years, you owe it to yourself to see how this actually works. I've put together a short presentation that walks through the entire technique step by step. To watch it right now, just point your phone's camera at the QR code on the screen. It will take you straight there. If you're watching from a computer, there is also a link pinned in the comments below this video that will take you to the same place. Take a few minutes to watch it. It may be the missing piece you've been looking for. Now before we wrap up, I have to be straight with you about something important. Most stuck stool episodes are mechanical. They're harmless. They respond beautifully to everything we've talked about so far. But the body also sends clear signals when something more serious is going on, and these signals deserve attention, not silence. See a physician promptly if you notice any of the following: blood in the stool, especially dark blood, or blood that's mixed in rather than just on the surface. A small streak from straining is one thing. Anything more deserves a look. Unexplained weight loss along with changes in your bowel habits. A sudden change in the shape of your stool, particularly stools that have become pencil thin and stay that way. Constipation that started suddenly with no clear cause, especially if you're over the age of 45. Severe abdominal pain, vomiting, or the inability to pass gas. These can signal a true obstruction, and that is a same-day medical issue. And finally, repeated episodes of fecal impaction, where stool gets so stuck that you simply cannot pass it at all, even with the remedies we've covered. None of this is meant to frighten you. It's the opposite. Knowing the warning signs is empowerment. Most of the time, the answer is simple, but when your body sends one of these signals, listen. So let's pull it all together. Stool stuck in the rectum is its own problem, and it needs its own solution. Regular laxatives that work high up in the colon often miss the mark entirely, which is why so many people feel like nothing helps. When you're stuck right now, the rescue is simple. 1 teaspoon of milk of magnesia on an empty stomach with a full glass of water, or a glycerin suppository for something even faster and more local. Then sit properly, feet up on a small stool, knees above hips, lean forward, belly soft, and breathe out slowly. Let go instead of pushing. To keep it from coming back, 2 kiwis at dinner, a tablespoon of ground flaxseed in the morning, a handful of prunes in the evening, enough water, fiber added slowly, and the moment your body tells you it's time, you go. Your body is not fighting you. It's asking to be heard. Listen the first time, and it will rarely have to ask twice.